I want to talk about the press conferences now in general. And by the way, I wasn't muted. Well, I was muted, but it wasn't my fault. It just the buttons were.
I think there was a technical issue in getting you unmuted.
And maybe that's why I can bring it up this time, because you know I'm being anti this. Yeah. We've talked about it many times, but not particularly in public. But I think it's time to raise this now. Why are we still, I'm talking about we, the press, not allowed to actually be in a room with you guys to actually ask questions? You know, it's so different on. I can't tell you how. What's the word? It's very tricky on Zoom because we never quite get a good feed. It cuts in and out. The sound stops, then it'll catch up. You sometimes don't hear what we said or whatever, and then there's all sorts of technical issues on it. And it's not the same, is it, as doing it? You know that. Us sitting here talking is a way different way of doing it than if you're down the line. And so I am asking a question on behalf maybe of some of the press definitely who have this thing. And it's costing the taxpayer money to do this thing now. I mean, come on. Can't you... and why? Okay, there's so many questions here. Why still do a weekly one? Why do it in the format you're doing it in? And that'll do to start with.
Well, let's start with those. Yes. So let's take the first one first, which is why are we doing a weekly one?
Yes, and it's now way off target and off the original COVID now, isn't it?
Yeah,
we had
using
Brexit,
it for various briefings.
It's
now,
presidential.
one of the reasons we've gone back to weekly is we did obviously stop them for a while, and then we've got various announcements that needed making. You only have to look at what happened every time we announced there was going to be a press conference. There was, in some quarters, mass panic, where people thought they're going to announce something. You saw the rumours on social media that went round and round and round. So there is always something to be announced each week, even if it's not necessarily on COVID-19, but a chance for the Chief Minister to update on Brexit.
He could do that in an email almost now. I mean, this is ridiculous, some of the stuff.
So not having that weekly slot, I think, would actually cause more problems. In fact, one of the things I've had from people emailing me is they actually find it quite comforting to have that weekly slot, even if it doesn't necessarily change the world. It's not change the world announcements.
Yeah.
So that's the reason for keeping it weekly, because I think it is important we communicate.
It's presidential though, isn't it, almost? I mean, it's like this. Here we are on a Thursday.
I'd never describe myself as
I wasn't thinking of you. So I wasn't thinking about you. But, okay, we could be light-hearted about this, but it does have a cost implication as well. I mean, the press could come in, you could send an email out, whatever.
It does, but when you actually work out the cost for what it actually is delivered and the audience that it's getting, across all the different mediums and including watchback audience, it's actually considerably quite lower than other formats that government could potentially do. So now let's move on to your second question.
It's a press conference without the press there.
Which is your format thing. From my personal point of view, I believe that, from government's point of view, I believe they think that is still the right format to be using at this time.
Well, the answer was actually the room's too small, isn't it?
And the room is too small.
Which is
bizarre. It's being used at the moment.
Why
to
pick a room?
To fit because Cabinet Office is very limited in space.
Oh, come on.
Terms of it. But from a personal point of view, I don't mind whatever format of interview. Yeah. I mean, I'm sat here with you today and we have some great face-to-face interviews.
And people think we don't like each other. How many times do you keep saying that? But I mean, don't get me wrong, I really enjoy the access, and I think it's really interesting, and I know the public love it. Although, the feedback I get can be quite hard. No, that's the wrong word. It can be quite horrible, actually. But, so you think it's still worthwhile doing anyway?
I think it's most definitely worthwhile doing.
But how wide are you going to go on the brief? I mean, you turning up, normally doing the numbers and all that sort of thing, don't need it anymore, do we? I mean, at the minute.
Well, the numbers are published online, so if you notice, I haven't been doing the numbers the last few. I've used it to raise various things going on within health, because although we haven't got any cases of COVID-19, in terms of our health response, there's still a lot of things adapting and changing. So hopefully the updates I've been able to provide. So for instance, obviously Friday you mentioned about the letter, which seems to have overshadowed everything. But it was an opportunity for me to actually mention as well about, rather unfortunately, the abuse that some of the GPs receptionists have been getting, because they've been asking the COVID-related questions.
Everyone's getting abused. I bet you this is social media the way it goes. Well, these are in person, were they?
These are in person.
People out standing there.
People actually phoning in when they're phoning up. So it was a chance for me to get across the message that, the receptionists aren't doing this because they want to. They're doing this because they need to, because we do need to ask if someone has travelled in the last 14 days, if they're displaying any symptoms. That doesn't mean people won't get doctor's appointments, but it's just different precautions have to be put in place. And so at the moment, unfortunately, when we're in a worldwide pandemic, there are those questions that the reception at the point of contact do need to ask, and it's for the protection of everyone. But unfortunately, in some cases, it has led to some quite nasty abuse. And, you know, to be fair, I appeal to people, let's keep that community kindness that we had throughout the main pandemic period going, and be understanding that sometimes those questions do need to be asked to people.
But we've all seen this as well, haven't we? People who want the borders open or the borders closed, they are very, very determined, some of these people, and very vocal. I mean, I get it. You must get it.
I mean, it's, you know, it's an emotional time for people. I mean, you've obviously got people exceptionally concerned who don't want a second outbreak on the island, who may have health conditions themselves, or their loved ones might have health conditions themselves that make them vulnerable, and particularly the older generation in our society. You know, they're operating their lives as normal at the moment. They don't want to end up back shielding or having to put their lives on hold. But equally, you've got the other side where there are people who don't maybe have much family on the island. Most of their family is based in the UK or further afield, and they're feeling really, really isolated.
Okay. How did your tabletop go? I mean, I touched on it, that's my question really, but you had a sort of tabletop exercise. Is that the best way of describing it? All the different consequences, was it that sort of game? Was it?
Yeah, Council of Ministers has workshops normally every single week on various things. Okay. So we have the main Council of Ministers meeting, and then we normally have workshop exercises on various things, not just COVID, but other things around government. Unfortunately, with it being the fortnightly review where we were looking across the board of everything, that workshop overran, which is why the press briefing got pushed off from Thursday to Friday, because we thought it was important we'd done the entire thing and we weren't going out with sporadic announcements. And
if I remember rightly, the Chief Minister said we have got all these great plans now, but we're not going to tell you, the public, them all now. Can't we have access to this information?
He didn't quite say that.
I'm trying to,
I mean, you're very much paraphrasing
right,
there.
And
so let's make it absolutely clear. Yeah. What the Chief Minister was saying is we review everything every 2 weeks. So there's elements that may change now. So for instance, there is the patient 7-day in test. Then there's other things that people say, well, actually might be of use further down the line, but we're not at that point yet because the infection rate in the UK is too high. So what will happen is that will be considered again in the next review in 2 weeks' time. So it's not saying we've got some great plan laid out, but we're keeping it away from the public. What the Chief Minister was saying is things, as we did during the main part of the pandemic, they have to be done step by step. So there might be options there that we might think, ooh, we'd like to explore that, but the current situation in our neighbours, our near neighbours, don't allow us to do that safely at this time. So it's kept, should we say, on the back burner for when the infection rate comes down, the Council of Ministers will consider it. So there's not been these raft of decisions made that we're going to turn around and go, oh, we're keeping that for a week on Tuesday, we're keeping that for a week on Thursday.
This is myth busting all the time. All the social media gets carried away with itself, and I must admit, you look at it, I look at it, and you go, ooh. But seriously though, that 7-day now for people who are going for treatment, that's back to really what you didn't want people to do. So is this creaking the door open a little bit more?
This is we've got it very clear. This is only a handful of patients it will apply to. Right. Literally, I can probably count them on my 2 hands, the number of people. It's people who travel over continuously, regularly for treatment. So the limit is 2 treatments within a monthly rolling period, because unfortunately we do have people who receive life-saving treatment and may have to travel every 7 days or every 14 days. And what that means by moving back to the strict 14-day isolation is the fact that they're never out of isolation. They're living in permanent, either in a hospital environment or an isolated environment at home. So because of the very low numbers that, like I say, I can probably count on 2 hands.
But we have contract workers, don't we? I mean, I know people who do 2 weeks on, 2 weeks off or something. They work on ships or oil fields, whatever. They're in the same situation. Maybe they're a month on and month off.
Well, the 2 weeks on, 2 weeks off isn't so much of an issue in that way, because there is different options and pathways open for certain people in that regard as well. Okay.
And how are we doing on key workers? Has that all been reviewed?
Yeah, the key workers has been reviewed.
Did you bring down the list now?
There's various pathways. The criteria remains exactly the same.
Oh, okay.
In terms of key workers. That was, I think we announced that about 2 weeks ago.
I know, I just wondered if this was another thing you're great answering, but I have to find the right question to ask you, and then you come out with these answers. So I have to keep doing this all the time.
And I'm always good at asking myself questions sometimes and going off on different junctures, Paul.
Because you might just come out with something completely new from there, but it hasn't changed recently at all. So the key workers.
No. So there's the different pathways with key workers, which I think sometimes confuses the public. I'm not sure if it's up online yet, but the Chief Minister did make a pledge at the press conference that we'll publish some of the pathways so people can understand them a bit more, so they're not this sort of mythical thing that we keep referring to every so often.
Okay. To finish with then, are you going to have a little Santa on Santa on your next press conference? Because I can imagine this bag over your shoulder with all these letters that people want reading out. What are you going to do now?
Well, I've got the weight for it, but I'm not quite sure. I haven't quite got the white beard.
I do have
yet.
A point in there, though.
Well, no, I mean
what are you going to do now?
This person,
choose?
this person specifically, I think, had a valid point to make that was different to the arguments that had been put forward before. So it wasn't rehashing stuff that had already been said. Like I say, when I spoke to them on the phone, they were exceptionally upset. They are an employee. And it would have looked very hypocritical of me, Paul. As I said, when I'm sat here with you only last Monday saying everyone's views should be taken into account and should have an opportunity to be aired.
That's my point. You might have now lots of other viewpoints, that's all.
And, and people are capable of airing it over various different platforms.
Well, we'll see you on Thursday, unless you overrun, and I'll still be a voice somewhere in the distance. At the moment, watch this space.
Well, we've always got these, Paul, where we're sat face to face.